making a bed, right? Something we all do all day long. So these green non-disposable pads are awful on the skin. Like, I don't know if you've ever rubbed your hand across this, but it's really abrasive, okay? So then we have to think about someone who is urinating or stooling the bed. This is gonna tear their skin up, right? However, this does protect our beds so that we don't have to do a full bed change, right? So, I like to put this down first. Okay, so now our bed is protected and we have something that can help us move the patient around. And then I like to put the sheet on top. So you can just use a flat sheet. It doesn't have to be a draw sheet. Right, and I fold it in half. Okay, and now the patient is protected from that abrasive green pad, right? Nice and soft. And then I like to put these on top of the sheet. So I've gotten a lot of, information from, our unit aides saying, well, we're not allowed to use those because they're expensive, right? They're only for specialty beds. Okay, that's fine. So if that's the case, we can use one of these. However, I don't want it here, okay? Because this plastic backing makes it so that the urine and the stool doesn't go anywhere. It just sits underneath our patients, right? So what you can do is put it underneath.
Oh, that's
Put it right underneath the sheet.
yeah.
Okay, boom. And then the sheet will actually help wick away the liquid, okay? Beautiful. So let's talk about specialty beds. As most of you probably know, Jillian and I are leaving Lourdes.
Wow, where'd that come from?
Yeah, okay, well, Lila didn't know. So we're leaving Lourdes Hospital. So with the specialty bed, we get a lot of, consults just for a specialty bed. You don't need wound care to say this patient needs a specialty bed. You are the aide, but you are, you're the foot soldier. You're the one who's gonna know if that patient's getting out of bed. You're gonna know if, they're urinating the bed. You're gonna probably be, sadly, the first people to know if they have any pressure injuries, okay? So you don't need an order from a doctor or a nurse practitioner or anybody for a specialty bed, okay? Ask the nurse to have the secretary order you one. The end, simple. On a specialty bed, you have to use a flat sheet on the bottom, okay? No bottom sheets, so nothing with the corners that wrap around because that defeats the purpose of the bed. And then you can use a draw sheet underneath the patient and your dry airflow pad, and that's the only thing that's allowed to go underneath the patient, okay? On a specialty mattress, if you were to put the, non-disposable chucks, it totally defeats the purpose of the specialty bed, okay? All right, so now we're going to transition into a conversation about moisture barrier ointment and moisture barrier paste. So, moisture barrier ointment is a Vaseline-based product, okay? Moisture barrier paste is a zinc-based product, okay? So, moisture barrier ointment, I know that prior to me taking this role here at our hospital, it was believed that the moisture barrier ointment is good for people who are incontinent of urine. Okay, I say don't even bother with that step, okay? The moisture barrier ointment locks liquid in, okay? It's like you were going to put Vaseline on your dry elbows, right? You don't do that because it's gonna keep them dry. You do that because you're gonna lock in the moisture, okay? So moisture barrier ointment is great for dry legs, dry skin on their back, okay? But not for their groin, not for their butt.
How about
Okay.
like their heels?
If their heels are dry, Lila, you can absolutely put that. And on dry
Because I do
skin,
that.
it's great.
Okay.
But if they're incontinent of urine, use the paste. Okay, so the paste has zinc in it. Zinc is an antioxidant. It's really soothing to the skin. It's also gonna lock moisture out. That being said, a lot of people have asked me, well, I like to mix them because it makes it easier to come off. Well, you don't want it to come off or it's not protecting the skin, okay? Also of note, the paste, you just need a thin layer, okay? A lot of patients have it caked right on. There's no point to that, okay? That's gonna cause more harm than good. You just want a thin, almost powder-like layer of the paste on the skin. Very, very thin, okay? And you can use the paste on the buttocks, within the groin, under the abdominal apron, and under the breasts. Which brings us to a conversation about this stuff, okay? This is the miconazole powder. It's on everybody's cart. It should not be. I have asked to have it removed. The nurses need access to it. That's fine, I'm not gonna fight about it. But as PCAs, you guys aren't technically allowed to administer medications, right?
Right.
This is a medication. This is an antifungal medication. Yeah, okay, you can buy it over the counter, but by putting this on all of our patients, we are creating super fungus bugs, okay? If you think your patient has a fungal rash and needs something like this, get your nurse to look and have the doctor order an antifungal, okay? This is garbage. It gets really cakey and pasty, okay? It binds to pubic hair. It makes it really uncomfortable to come off. I don't like it. So if you feel like your patient, you know, if you have a diabetic who's overweight and they're very wet, okay? Moisture barrier paste, thin schmear, okay? And a pillowcase. That's gonna wick the moisture out. It's gonna protect the skin from breakdown. Beautiful. Okay, so then how do we get the paste off, right? You can get the paste off with any 3 of these lotions, okay? The lotions, which we all have on our carts, break down the paste, gets it right off, okay? It's wonderful, wonderful stuff. If you can't break down the paste with the lotion, you can get an order for mineral oil, okay, to use topically, and that will cut right through the dry, crusted, thick, nasty paste, okay? So since we're talking about incontinence, I also want to talk about Cavalon Advanced. So this is a product, it's not a medication, it is a wound dressing, okay? This is wonderful stuff. So it's a wand, basically, that you crack, okay? Okay, and you let it drip, and then you can just wipe it on the patient. Now this can go over open wounds, this can go over the butt, this can go within the groin. It has to dry for 60 seconds. It says 30, but if you don't let it dry for 60, you will have butt cheeks sticking together, okay? All fun and games until you're trying to peel that apart.
That'll stay clean that way.
Hold on, let me just peel that apart for you.
It's happened a couple times.
Oh boy.
But basically, it creates a plastic layer on top of the skin, okay? And that plastic layer stays on for 3 days. So what does that mean? That means your patients with C. diff, okay? Put this right on them, okay? They have watery diarrhea, they're incontinent of urine and stool. Cavalon Advanced is gonna be your best protection against pressure injuries, moisture-associated dermatitis, and breakdown, okay? It can be used, like I said, on the butt, within the groin. It doesn't necessarily have to be used on heels or elbows or ankles or anything like that.
But you can put it right over the wound?
Yep, you can put it right on top of the wound,
Oh,
right on
it's
top
an
of open
open
skin.
wound.
Yep,
Really? Yeah, I know.
Right on
I
top.
just never could do that. Okay.
locks right on. Well, it's a new product.
Okay.
Okay, brand new product. Locks right into the, it's called Cavalon Advanced. And the reference number with distribution is 5050. Okay, so you can have your secretary call, or you can call and say, I need some Cavalon Advanced. 5050 is the reference number. They'll probably tell you they don't have any. But just encourage them to look a little harder. We also have this skin prep. So this is a skin prep that everybody's had in their unit for a long time. This can be used on butts as well. It just doesn't last as long as the Cavalon Advanced, okay? So during your bed bath, dry the butt, put a little bit of this on, and some paste. This does not cover open wounds, okay? You can also use this on elbows, you can use it on knees, you can use it on heels. This locks out moisture, and moisture is one of the greatest risk factors for pressure injury, okay? This can also go over the bridge of the nose for your patients who are wearing BiPAPs and CPAPs, okay? It can go behind the ears for people wearing vapotherms. So let's go back to BiPAPs and CPAPs. Quite often we get pressure injuries right along the bridge of the nose, right? From the pressure of those devices. And then, you know, we get, well, how do we cover this up? And a lot of people were like, oh, put the foam on. Well, the foam, you know, messes with the seal, and so then they just can't use it. So your best bet, if you have a patient who's gonna be wearing a BiPAP, is preventative care. So if you have a patient, they're wearing a BiPAP, they have nothing on their nose bridge, skin prep them, okay? Lock out that moisture. Cut a piece of this foam to go right over the nose, right? Okay? Just a sliver, that's fine, right where the BiPAP is gonna hit. And then you can take a Duoderm, okay, and put that right on top of your foam, and this is gonna act as a secondary skin, and it's gonna aid in the seal. Okay, you just have to make sure that the white foam is covered. Okay, so let's see. Do you have scissors? Anybody?
They have ostomy scissors.
Yeah. Who's got them?
Right here.
Perfect. Okay, so just as an example. This is going to offset the pressure area over the bony prominence, right? So let's say that this is the foam that I use, okay? I'm going to want my Duoderm to be bigger than that and cover this area, okay? Because that's how you're going to seal it, okay? Okay, so these white Mepilex foams are fabulous. They're one-sided sticky and one-sided foamy. They're very, they're my preference for wound dressings, okay? These are not. So you should all have one of these at your desk. So if you want to open it up, yep, and then just peel off the backing, okay? Peel it right off. So quite often when we have an incontinent patient who has a pressure injury, we will get to the unit and they will be wearing one of these over the pressure injury on their sacrum, and it'll be full of urine, or it'll be full of stool. This is it's garbage. This is garbage, okay? If you're holding urine and stool onto the wound, guess what? It's gonna get worse, right? Or we have patients who get skin tears, and we just slap one of these right on top. So put it on your skin and try and peel it off. Watch what it does to your skin. It peels your skin with it. And it leaves a sticky residual, okay? Yeah, now imagine being 93 years old with your skin paper thin.
Skin tear. Instant.
Exactly, boom, done, right? Huge problem. These are fine to use on heels, okay? Elbows, skin prep first though, okay? So if you're gonna put one of these on your patients, use a little bit of this, okay? That's gonna protect the skin, okay? You can put it on the elbow. If you're gonna take one of these off, you wanna use adhesive remover, which is something we all have on our carts as well, okay? So you basically just peel this back, right? You're gonna take your adhesive remover and you're gonna swipe it to get the dressing away from the skin, okay? Instead of pulling, just swipe. It'll push it off, okay? Great stuff. Let's see. Waffle cushions, so we all have these on our carts too. These are wonderful for our bony little elderly patients who, you know, don't have any fat left, no fat pads on their butts. This can be used, you know, in the bed. This can be used in the chair. It needs a pillowcase to cover it, okay? Because if this plastic gets on their skin, it's going to be really uncomfortable. And the pillowcase makes it a lot easier to clean, okay? If you have a bariatric patient, you can call distribution, and they have bariatric versions of these waffle cushions. All right? Let's see. What else do we need to talk about wound care wise? I think we've covered
think we're good.
the wound care stuff.
Yeah, I think we're good.
Okay, cool. You
All
want
right.
to stop and we'll
Yep.
transition? Okay.